Hello and welcome. Thanks for watching our channel. Today, we are very excited. We'll be talking about how to prepare yourself for residency match day and beyond. So we have divided this session into two sessions. This is session one. We'll be covering four parts in this session, and then we'll have a session two as well. So don't forget to watch both the sessions as we go along. So are you ready to start? Okay, I am. Let's go. So here, as you see that we'll be covering the first half in this session, where we'll be talking about what is the significance of residency for you. Years you waited for the match day, and now it's days apart. What if you match? And that's an outcome we all are looking for, right? And in some cases, what if you don't match? So we have a case scenario where actual life scenario when an international medical graduate who went unmatched, and this is his testimonial I'll be sharing with you today. Okay. So it's a big day coming in next few days. You'll be prepared. You'll be ready. It's a major life event. This is will be defining moment in your life for those who are international medical graduates, especially will be moving for on this day, looking forward to this day for years since you start applying for it. Overwhelming emotions, and I cannot emphasize enough that you will, of course you will be on a roller coaster ride, and especially the way it is set is that on it you'll find out if you matched or not, so you'll be relaxed, and then it'll take you a few days to find out where did actually you match. So uh, be aware of that you will be having some those emotions. And finances, you might not be thinking about it, or you don't have much plans about it, but it's going to be a life-changing event. You have to think about your finances as you go forward. And I think we have one more slide, but we'll talk about more into finance part of it. You'll be thinking about moving. If you are already living or staying in America, then you might be moving from that city to your match city. Or if you're already there doing your rotations or research, and you might not have to move because you're already in the city, but that will be a big decision, and you have to plan it accordingly as well. And of course, even though it's a big life event, it's an academic life event, and your other life events are tying in with that. And we'll comment on it in a separate slide. What does it mean when I say other life events are tied with that? Overall, this is an American dream, which is going to be true in next few days. So I'm excited for you, and I hope you're excited as well. But just be excited. Don't be too anxious. And it's hard to say that. I would say that as days are left from your years to match day to now days to match day, relax. I know it's hard to do that, but this is the time to be relaxed. Your life is going to be very different once you match, and you'll be thinking and doing all those things which we talked in the previous slide, and talking in the next couple of slides. Eat well. You may have to make sure that next few days, because you may be anxious, things might be going on, forget to eat well, keep yourself hydrated. And given the current scenario, as we are recording this video in 2020's coronavirus pandemic, it's going to be very important that you have eat well, you allow yourself with some nourished food. Be physically active, hit the gym, walk as far as you can do it. It's safe to do so, about avoiding public, or as we say during this coronavirus time and pandemic time, we would like to say that we would like to maintain a social distancing as well. So if it is safe to do so, hit the gym, be physically active. You can do some core body exercises within your apartment, within your home, if you can't go out or you don't want to go out. Most importantly, identify your support system. In the case you match, you'll be requiring for your residency in your intern year. In the case you don't match, unfortunately, you will definitely requiring some support system. So then they can give you enough motivation to apply and match it next year. Remember, I said in my previous video that you are not going to match just this year. You will match again next year. So it's never the end of the road. And last but not least, that focus on your task at hand. Many of you are in a research program, observership, studying for your step 3. So if the anxiety is kicking in, I would say focus on the task you have at your project, your research project, your observership, or whatever you're doing. I think focus on those next few days, and that will help you relieve a little bit anxiety there. Okay. What if you match? Congratulations. That's a big deal. You must be happy and you should be happy. And we congratulate you for being matched there. However, your day-to-day life will not change for a while now, for a few weeks, few months, until you start doing those moves or moving to a different city and so on and so forth. So maintaining your lifestyle, eating healthy, sleeping well, exercising will continue to help as well, because it'll be a happy moment for you, but next day you'll be going back to think what you were doing it. So make sure that you're aware with it. Now, whatever you were doing, clinical research, observership, or anything else for that matter, if you are practicing somewhere else or doing JR-ship or SR-ship, your focus should shift totally. How you'll be doing really well in your first year of residency, maybe medical residency, surgical residency, or anything else. And prepare yourself well. This is your time to do so. I hope by now you would have done your step one, step two CS, and step three as well. If not, take it out from your way before you start the residency if you're planning to do it before residency. Otherwise, focus on your clinical training and say you want to excel in there. Needless to say, the projects you're working on, you want to finish them. You want to finish them. And when I'm talking about projects you're working on, I'm talking about clinical research projects, review articles, or case reports, because this is your time to finish them and submit them and then start your residency. If you don't finish it, believe me, you will be looking at unfinished projects a year from now when you'll be brushing up your CV. So please do complete your projects or focus on completing your projects. Don't take any new project now. This week onwards, you should not be taking any new projects whatsoever unless it's required by your PI or your mentor. And then if they're paying for you, you have to take it, but don't take a major big project. And set a transition plan for anybody. This is especially for those who are in clinical research or observership, or working with somebody remotely, that put up a transition plan that unfinished project should be transferred over to your PI, to your mentor, or somebody else who's working on those areas. So then there's a continuity of those projects and you still get the credit in the second year or first year for residency or second year. And whatever you do now, and please watch other video when we talk about it, after our rank list submission video, we talked about whatever you do now till you match, it will help you in your fellowship. You're already matched, so nothing you can do which can help you there. But what you do now in terms of clinical research projects, letter of and your case reports, case series, whatever you're working on, randomized control trial if you are lucky enough to be working on, or cohort studies, this will help you get into fellowship. So make sure that you finish those projects what you're doing it, or have a transition plan that'll help you towards your fellowship. Your focus should shift now after a few months of your residency, that how you'll be matching it to a good fellowship. This is the life events I was talking about. If you can remember, 3 F's: fellowship, finances, and fiance or fiance or fiancee. When I say fellowship, we can't. I cannot talk enough about it. That now your next academic goal will be matching into one of the fellowships. If you're looking into, many of you will be going directly into practice, so it doesn't apply to you. Finances, be very careful about it. Nobody's going to teach you how to do your finances well. Idea is you want to have one or two major credit cards and then keep paying your bills to build up your credit history if you're coming to America for the first time or for long. Two, start investing into from day one into your retirement plans. They call 401ks, Roth IRAs, and for those things. Please ask about them to your financial planner when you go into residency. Each institution provides some of it, or do search, or wait for our video. We'll be publishing that before you start your residency, so you can look at it as well. And then when we say fiance and fiancee, it means your life events. Those who are not married, it applies to you as well. It to you only looking into those life events. Most of you will be getting married or having a child during this residency time, or other life event in terms of buying a house, buying a car. So point is that be ready, start thinking about those things and see how you'll be managing those things during your residency. I suppose that many of you will not be doing any of those things during your intern year, but year 2, year 3, or year 4, for those who are 4 years residency, that may happen, and prepare yourself mentally for these things. So your life event should not wait anymore now if you're planning. So now the last part of it, This is an example. This is a testimony from an IMG who went unmatched for a year, and then he matched again next year. So let me walk you through. I will not read all of it. I'll let you read it, but I'll highlight some of those things. And I think I highlighted some of those things anyways. So this started as after I went unmatched. That's one of the IMGs we talked. He said that I was very disappointed with the results, even after having a good USMLE scores. And they were good. Late times, it was late or 90s, 99 percentile or closer. He said 1 week after match results, I gathered myself and had strong belief that there was something missing in my profile. I did not match, not because of bad luck, but because of my own shortcomings in CV and communication skills. This is his own admission, and see how he overcome some of these things. After discussion with my friends or friend who matched in this second attempt, I started applying for research position in prestigious hospitals like Mayo Clinic, Harvard, Hopkins, so on and so forth, to get some good name in CV. And he was lucky enough to get a research position at the institution. We're not disclosing at this point. He started research at the institution in June 2016, let's say. From his first day of joining, he said, I started working really hard to build my CV, making connection, asking clinical fellows for work to get some more publications. He tried really hard to get good letter of recommendation as well. And if you see that how he was building networking, doing his connections, working hard towards projects, and then getting good letter of recommendation as well. Little busy slide, my apologies for that, but he continued saying, I started contacting program directors and coordinators from July 1st. I wrote a very personalized email to each program, asking sensible questions and expressing my interest. He continued, says, I sent emails to more than 300 programs, more than 1,000 emails. I got positive response like from 40 of them, and general response from another 40 programs. He says again, after applying, that is your application for ERAS, on 15 September, I continued from same thread and reminded them that I've applied in your program or their program and looking forward to hear from them. He says, meanwhile, I was trying really hard to improve my communication skill. That was the last piece of the puzzle. He was trying to fix it. So after starting 16 September, he wrote almost 300 emails each day, which is a little too much. Most of you might not have to do it if you will go on match, unfortunately. He was expressing his interest because now he's built up a rapport with them. And then started getting interviews, and he didn't stop until sending those emails until he got 22 interviews. And that was the initial target. So imagine that might not be true for each of you or any of most of you, but getting anywhere from 5 to 10 interviews is a success that you will be getting. That be matching. That's what I've seen in last 15 years. That if you get 5 or more interviews and then do a decent job in interview skills, you will have a higher chance of matching. And our second session, we'll talk about specifically mostly on interview skills as well. We have a couple of videos where we have interviewed the residents, IMGs, international medical graduate, who have talked about the LOR, personal statement, and interview skills as well. So please do watch those videos. Please like and subscribe to our channel, and then let us know what you like in these videos so we can add those things in our subsequent subsequent videos. So for now, we will be ending this video, and then we'll continue our session 2 for the second part of this one. Thank you for watching.